Hey everyone, it's Dr. Heather, your virtual sports chiropractor, and in another video I talked about the different types of low back pain that you could be experiencing and what that cause may be from. And one of them happened to be a spondylolisthesis. So that's what I want to talk to you guys a little bit more today in detail is what is a spondylolisthesis and the different degrees or grades of spondylolisthesis that you could be experiencing. As I mentioned in the previous video, I mentioned that a spondylolisthesis is actually a slippage. It's where one vertebrae will slip either forward or backwards, which is known as anterior, posterior, on top of the other vertebrae that sits below it. Spondylolisthesis can happen anywhere in the spine, but we do frequently see them more often in the lumbar spine. And a lot of times this is just due to the fact that usually we have a little bit more of an increased lower doses, and that's the curvature to your lumbar spine. Now, if you were somebody who was recently diagnosed with a spondylolisthesis, you may be saying, but I really wasn't having that many symptoms, but the chiropractor wound up taking an x-ray and pointed it out. Well, that's very true. Some spondylolisthesis can be asymptomatic. You may not be experiencing any discomfort whatsoever. And then there are some that could be actually creating a lot of discomfort and not a more severe case. A majority of spondylolisthesis, though, are never really that severe, and they can be managed with great palliative treatment. So if you are wondering if you do possibly have a spondylolisthesis, you may be wondering, well, what would be some of those symptoms? Well, some of those symptoms can be very similar to just a classic low back discomfort or low back stiffness or even feeling like you've strained a muscle. Now, a lot of times, when you go to the doctor and you complain about low back pain, they don't necessarily take an x-ray, and a spondylolisthesis will only really be discovered on x-ray, simply because we actually would be doing some measurements and looking at various different angles of the spine to determine if there is an actual Most commonly, a spondylolisthesis can be more that of a congenital disorder, meaning we were actually just born with that spondylolisthesis. Now, more than likely, though, usually a spondylolisthesis could be a result of a traumatic event or a degenerative event, meaning as we've aged, we've also now created some more damage to that area of the spine. Now, again, there are 6 different classifications for spondylolisthesis, but the common ones that we could actually look at, being that of chiropractors, are going to be more of the congenital, the degenerative, and the traumatic. Now, it is important to know how to best treat a spondylolisthesis in terms of the things that you can do to really kind of make sure that that back pain doesn't flare up due to that spondylolisthesis. Now, again, as long as that spondylolisthesis isn't that of a severe degree of slippage, which again, like I mentioned a little bit earlier, the way we determine the degree of slippage is by using an x-ray and then by using various different angles of measurement to really indicate what that slippage looks like and how best to treat it. Now, if it is beyond a type 3 or grade 3 type of slippage, we may be actually using more surgical intervention. If it is a grade 1, 2, or 3, a lot of times we can use more preventative measures to help. Now, the main focus here with dealing with spondylolisthesis is to eliminate that discomfort that you are feeling in the low back pain, and if it is associated with any radiating pain into one leg or both, we want to go ahead and address that first. Then the next is actually making sure that we don't actually create more slippage, meaning that we're working on really designing the proper home exercises for you to do to really help in reducing that slippage from getting any worse. And then from there, it's also looking at making sure we're restoring good flexibility to the spine as well, especially if it is more that of a degenerative slippage. So like I mentioned, if you were recently diagnosed with a spondylolisthesis and were wondering exactly what type of exercises you could do or how to go about them, do leave those comments down below, because in another video I'm going to go through some basic stuff that you can do at home that can help with the more preventative side of treatment if you have a spondylolisthesis, and how to kind of make sure that we don't create more damage or wind up needing surgery one day for this type of condition. Now, if you found this little video helpful, give it a like. And as always, don't forget to subscribe to the channel. This is Dr. Heather, and I'll see you in the next.